Yeah.
Yeah. How you doing, Mitchell?
Sh- I was craving some frozen grapes covered in chocolate,
Sounds nasty.
or some covered chocolate frozen grapes.
I had a
Or
Jaffa
some
cakes
frozen
today.
chocolate on
Jaffa
grape.
cakes
You
are
know what?
so
I'm
good.
gonna stop talking.
Jaffa
Welcome
cakes are
everybody who's listening. I just literally just got you off. Sorry. Welcome everybody who's listening. Welcome back to our channel where we talk about everything medical related. Today's topic is going to be COVID-19 post vaccination care. So, as you know, as of today, the 23rd of April, um, everyone in in Pennsylvania, I don't know about any other states or countries, but everyone in PA above the age of 16 can get vaccinated for the COVID-19 vaccine. There are many out there. Today was just released that the Johnson & Johnson vaccine, 9 million instead of the 15 million or 12 that were previously available in for everyone, have been uh, re-released. I guess that's the word. I don't know. So that means that the 9 million vaccines of the JJ vaccine can start to, be distributed to the Gen Pop. So we're gonna have a lot of people choosing Johnson & Johnson because he came last. Some people are not gonna choose the Johnson & Johnson because he was in the news. If you haven't heard the news, then what are you doing with your life? So the news said that you heard the news, that right, Zach? There was if you taken the Johnson & Johnson vaccine, there were only like 6 cases in all in women where there was
Yeah, it
blood
was a
clots.
severe clot though. It was like a double clot type thing to the brain.
I don't know. I didn't read that far into it, but like all I know is just 6 people blood clots, and then it ended up being more than six. So the CDC stopped it, and I think it's been like 2 weeks or maybe 1 week.
It's been
So
started back
now,
up now.
yeah, so they have released it today. So this is post-vaccination care. So if you do not are interested in getting the vaccine, uh, then this video is not for you. So, anyways, so let's talk about this. So on my first slide, of course I put what kind of care do I need to do, but like, because we need to be very conscious. So if you have any trouble breathing, any chest pain, difficulty swallowing, or any life-threatening reaction to the vaccine, you need to call 911 immediately. I don't know what you'd be doing watching a YouTube video trying to diagnose, try to WebMD your symptoms, but call 911 immediately and go over there. All right. So post-vaccination care. So if you experience any mild common vaccination symptoms such as fever, fatigue, headache, chills, pain in your arm or joints within the first 3 days of vaccination, then the common treatments is it's very simple. I didn't do any of those treatments, but I did feel headache. I did had a headache. I did had some pain in my arm, and I felt fatigue. But the treatment, it's very simple, and it's taking the over-the-counter pill, so like ibuprofen, acetaminophen. I feel like naproxen would be like kind of too much, but like it's directed by the manufacturer for pain or fever. Applying an ice or cold compress for the areas of redness or swelling. So of course, if you had a headache, then you want to apply a compress to your neck or your forehead. And if you have a sore pain in your arm, you can do that as well. So using over-the-counter allergy medications such as diphenhydramine, which is the name what's the name of that, Zach?
Benadryl.
Why are you laughing?
Your pronunciation of it.
Well, yeah. Okay. What about this one? Loratadine, Loratadine,
Ranitidine.
or Loratadine. All right, what's that? What's the common name of it?
God, you Google it and it says Claritin.
Right. So Benadryl and Claritin, etc. So uh you can experience some mild allergy symptoms. I mean, whenever you go to get a vaccine, they will ask you like, do you have any allergic reactions to anything? And then they will sort of monitor you for like 15 to 30 minutes. At 15 minutes, you'll sit down in a room, like in a waiting area, and then for 15 minutes, and there will be like a nurse or a doctor just pacing by, just kind of like just chilling there, trying to see if everyone needs some help or anything like that. So like with mild allergy symptoms like hives, like raised red bumps, like welts or splotches on the skin, right? So just a reminder to everyone listening. So please report any reactions that you experience to receive the proper medical guidance for additional care that you may need. Um, if your symptoms are not getting better over several days, then you need to contact your PCP, or you need to go to an urgent care facility close to you, so they can evaluate what's going on. You know, I don't think we're gonna see any more blood clots from the Johnson and Johnson vaccine, but I mean, it could be possible.
I did
Um,
see anaphylaxis to it firsthand, so that was fun.
oh really?
A lot of people were going down. 1% anaphylaxis to be taken out, stretcher.
Sheesh.
A lot of people were fainting from it. So
Yes, I've heard about fainting. I have actually heard about fainting. I think there was a video circulating about fainting. It's a nurse that got fainted right after she got the vaccine, not as soon as it. But okay, so signs and symptoms unlikely to be from the COVID-19 vaccinations. Okay, so they're not likely, so they should not likely happen. Cough, shortness of breath, sore throat, runny nose, diarrhea, loss of taste or smell, or any weird body aches that are not close to the site of injection. So like if your leg is starting to hurt, that I don't, you know. Um, but yeah, so that's pretty much, what kind of care you need to do. But just to reiterate, so you need to mention before you get the vaccine, any vaccine of Pfizer or Moderna or JJ. Um, if you have any allergies, if you have a fever, if you have a bleeding disorder, or if you are in blood thinners, if you have or if you are immunocompromised, or do you have any medicine that you take affects your immune system. Also, you need to tell the person who's about to give you the vaccine is that if you're pregnant or you plan to become pregnant or are breastfeeding, or if you have received any other COVID-19 symptoms, or if you've had COVID before. This is just to document, it's not like they're gonna stop you from getting it, but this is just so they can be aware of potential anything, they can prescribe from it. Um, but yeah, so like some people experience site pain, so injection site pain, tiredness, headaches, muscle pains, chills, fever, joint pain, injection site swelling, injection site redness, maybe some nausea, maybe they just feeling unwell. Some people even have lymphadenopathy, yes, which is swollen lymph nodes. Um, I think the Pfizer vaccine, I think they have some side effects um, that are rare, but I think I was reading that they do might have some like difficulty breathing side effects, swelling on your face and throat, a fast heartbeat. But those are the signs of severe allergic reaction, right, to the Pfizer. It's like fast heartbeat, a bad rash of your body, or dizziness and weakness. Um,
so lots of side effects, pretty much.
uh, yes, I mean I did like 90% of the people will not feel anything, but
I mean, it will feel like a soreness in your
please
arm.
do not take a pain medication before you get. Oh yeah, it's sore for like a good 3 days.
Yeah, but what
It's
Mitchell was
sore.
saying is do not
But
take pain
I
meds
went to the
before.
gym, so like I kind of like moved it on purpose. I mean, it was I had to go to the gym to work out, so but it did help. So moving it possibly, has
Best to
some
move
sort
it.
of a illusion. But please do not take some ibuprofen or Advil before you go to get the vaccine. Take it after if it's like, a recurrent pain or anything like that.
Or Tylenol. He said Advil and
Oh, so yeah,
ibuprofen.
sorry. Right. So make sure that you are aware and informed, and it's out. If you're in Pennsylvania, if you're listening to this, schedule your vaccine. And if you are not, then you can find a state where it's actually having open walk-ins into their clinics, and you can get a vaccine.
West Virginia used to be giving them to open clinics. They might be still running them, but too sure right
Huh,
now.
possibly. Um,
So you can just Google and
Now
probably find out.
I don't know what they're gonna do for people under the age of 16. I don't. I'm
They're
sure they
studying in
will.
it now.
Yeah, I'm sure they will have some sort of study, and then they will decide if it's viable for them. But the latest thing, I think this is one of the last videos that we're gonna do about COVID. But the latest thing that I've heard, thanks for sticking all the way to the end, is that possibly we will need a third booster because every vaccine has two shots except Johnson and Johnson. So we might need a third booster within a year, or maybe a little bit later. So if you're taking the Pfizer, if you're already taking your two shots, within like 8 months or up to a year, you might need another shot to get another booster. Same for Moderna. I don't know anything about Johnson and Johnson because that one is like 60%, 70% effective. So, but it's like a one-time dose. So I don't know. We will
But
have to.
but it also prevents all the hospitalizations and also prevents
Oh,
severe
of
COVID.
course,
So
of course. And we're focused on science and trying to prevent as many deaths as we can.
has it
And
caused zero deaths.
yeah, if you do not get the vaccine, you will most likely end up getting COVID. And two things.
Hospitalized. That's it for this video, guys. We'll see you in the next one.
Do recover from it, but you do not. That's not a risk